My approach towards patient care really is predicated upon doing what's right for the patient. As a surgeon, people often come in to see me thinking that just because they're going to see a surgeon, that they're going to be having an operation recommended to them. My job is to do what is in the best interest of the patient, and often it involves telling the patient that they do not need an operation. I also need to think about, if it was my wife or my parents, how would I want them to be treated in this particular encounter in the office, and then whether it involves surgery or not, how best to do it, what's going to be the appropriate operation for them to have. The most important things that I want patients to know about me are that I'm there to be an advisor for them regarding their hip or knee complaint. So I tell patients, my job is to tell you what your condition is and what your treatment options are. Then you make the decision if surgery is even an option. You make the decision as to whether to have surgery and if so when. And my job, if you decide to have surgery, is to execute that surgery in an expert way. We like to work on preoperative education for our patients, have a very systematic approach towards a preoperative medical assessment because we want our patients to be healthy. We want to minimize risk, and so there's a lot of things we do to minimize risk because any surgery is risky potentially. And so we like to minimize that risk as much as possible so people know what they're getting into, and we have it done with as little medical intensity as possible. So for that reason, we like to get patients out of the hospital quickly so they don't have to be in the hospital.